Welcome, everyone, to another webinar from the Brain Aneurysm Foundation with our gracious moderator, Dr. Aaron Cohen, who was actually the one who came up with the idea to get these webinars going, and they seem to be very helpful to people, and I'm happy to be here to help out and be part of this webinar. And as you can see, the webinar is about the challenges with care for brain aneurysms, and coming from a perspective of not only myself at the foundation, but the other people who work there, answer the phones, address the emails, and also respond to questions that come across our support site. So I have, the majority of the questions I have here are things that we hear repeatedly. A bulk of them are actually answered on our website in different parts of it, but this gives an opportunity to have a direct question coming from Dr. Cohen. And then if someone needs to go back and look further, you will be able to use the website as a resource. And also, if there are questions that you think are pertinent, that are missing, I'm not going to read through every specific question. We'll go through the general ones. I'll pick some of the others as we go along. We'll also be paying attention to what people are typing in. So the next thing I just want to mention, you know, we are the Brain Aneurysm Foundation, and it's a group of people working together, our board, our staff, our medical advisory board, nurse professionals, survivors, caregivers, and their families. So welcome to everybody who is part of this webinar. And just as a background, I want everyone to know that the foundation was established in 1994. Our mission is written out there, but the highlights are that we provide support, education, awareness, and research funding. And we continue to grow every year. And right now, 2012 is looking to be a really successful year for the foundation, and we will be giving out $200,000 in research grants in September, so we're excited about that. So here we're going to begin with some very common questions. These are probably the top questions that do come in regarding brain aneurysm treatments. So the first question is, how do I select a doctor? People call us all the time. Sometimes they have seen one doctor at one facility, and then they went and saw a doctor at another facility. Sometimes then their treatment options are contradictory. One says clipping, one says coiling. So people want to know, how do they actually select a doctor to do this surgery that's very important?
You know, Christine, the best comment I have for that is get more opinions. Aneurysm surgery has undergone a significant transformation with introduction of endovascular coiling, which is undoubtedly safer than aneurysm clip ligation. However, there is still questions about durability of coiling long term. So if you have an aneurysm that is unruptured, you have plenty of time to ask around, get opinions, and don't pigeonhole yourself within one doctor or another. Unfortunately, certain physicians have certain philosophical convictions and may not be as easily changeable as we would like it to be. So if you have an aneurysm, my first recommendation is to go to an institution that offers all options. In other words, the surgeon does the clip ligation and the endovascular, physicians do the endovascular coiling. And so just because they offer one option, that doesn't mean they're going to treat every patient with the only option they have. So I would definitely get an opinion from a surgeon that does clip ligation, and I would definitely get an opinion from a physician who does endovascular coiling. And I would preferably like the two doctors to talk to each other. I would like to go to an institution that has a multidisciplinary aneurysm treatment conferences where both the surgeons and endovascular therapists talk to each other, because this is a very complex process and there's no easy answer to a cerebral aneurysm whose care is getting more complex every day.
Thank you, Dr. Cohen. Another common question, once they figure out who they're going to see, where they're going to go, what treatment option they are going to choose, is, are other family members at risk?
I think that's an excellent question. And based on the data we recently know about, If you have two family members, first-degree relatives,